This is CommonWell TV, where we're introducing you to some of the top health IT industry experts and finding out how their organizations are helping when it comes to interoperability. So let's go ahead now and hear from David Cohen, as he is the Senior VP of Product Management at Greenway Health. And David, Greenway was one of the founding members of CommonWell. So that said, how has interoperability advancements really changed since you guys came aboard?
That's right, Scott. In 2013, Greenway and a group of other healthcare IT companies passionate about solving interoperability came together with one simple idea: to improve the exchange of healthcare information. CommonWell is about providing the right information to the right provider at the right time, and for them to be able to use that data to make informed clinical decisions. So the premise being that you should be able to show up in an emergency room 1,000 miles away from your home and have your medical record be instantly available to the team providing care. Or that chronically ill patients should be able to show up to a specialty visit without needing to tote around grocery bags full of medical records. These are not radical concepts, but they're radically transformative to the people whose lives are impacted by these advancements. So data liquidity and the creation of this highway of data sharing has really changed the way healthcare data is shared. So today, CommonWell, as you know, has grown to over 80 organizations and 15,000 provider sites with over 200 million health records exchanged.
Since 2013, as you mentioned, this has been a lot of body of work and a lot of customer feedback. If maybe you could share one that possibly comes to mind in terms of customer feedback that really is kind of stuck with you.
Yeah, absolutely. So Greenway customers absolutely love this capability. And we only play in the ambulatory space. So if you think about pre-2013, these providers often had no visibility into what happens to their patients when they get admitted to the hospital or when they go to see another provider across town. So data now has the potential to flow seamlessly. And this is a really big deal to improving patient care. So some of the requests that we still frequently hear from our customers are around solving some of the friction that still exists in data sharing today. For example, how can we continue to improve making the consent process simpler, or potentially moving to an opt-out model? Or how can we get health systems that are not already on the CommonWell network to connect? But it's worth noting that this past year, we made a major industry breakthrough in interoperability when CommonWell and the Care Quality Network finally connected. So for the first time, Greenway customers are able to share data seamlessly with health systems that run on Epic, NetSmart, and other care quality only vendors. And our customers really love that.
So David, that said, let's put on your crystal ball. You saw some of that obviously enhance and get past that particular barrier. But what do you think maybe perhaps is the next big step in advancing interoperability?
Yeah, well, there's two major industry thematics that I think are going to be driving interoperability strategies in the coming years. 21st Century Cures Act is the big one. And now that officially dropped on Monday, the industry is really scrambling to figure out what it all means. So effectively, 21st Century Cures will force the industry to open up the flow of health data even further and put that control in the customer's hands. Ultimately, it's the patient's data, and they should be able to decide where that data goes and how it's used. So 21st Century Cures takes things one step further by mandating things like FHIR 4 standard, the US CDI data set, and it establishes loud and clear penalties to ensure that data blocking is not going to be a concern. The second industry theme that I still think needs to play out is one around patient privacy and consent. So last year, we saw big tech companies being put into the spotlight for creating partnerships with provider health systems that put patient data directly into the hands of big tech companies under the guise of HIPAA and business associate agreements. Most consumers, however, feel that they should need to give consent for that to happen, particularly when there's commercial implications to how that data is being used. But they don't need to give consent. And I think that's news to a lot of people. You know, we've trusted health systems to be good stewards of our data. We've trusted HIPAA. And now I would say that trust is being put into question. So what I worry about with 21st Century Cures is under the guise of EULAs and other things that, quite frankly, consumers are not really very savvy about. That sensitive patient data is going to be put even more at risk. So we really need to ensure that there's a framework in place for consumers to very clearly see who has access to their health data and how that health data is being used.
Well, Greenway Health, one of the founding members of the CommonWell Alliance, and without some of your guys' fabulous work over the years, we would not have the amount of members that we have today. So thank you so much, David, and Greenway Health. And for more on them, as well as more information on how you can become a member of the CommonWell Alliance, we invite you to log on to commonwellalliance.org. Good chatting with you, David.
Thanks, Scott. You as well.